Welcome back to Families in Action right here on KHTS AM 1220, your hometown station. I'm Michael Doherty, along with Cary Quashen of Action Family Counseling. And I said that because you're talking a lot about drugs, and I want people to know you know what you're talking about.
I might know. I might have a little bit of information.
No kidding.
I might have a little bit.
Well, if you don't by now, Cary, there's no hope for you.
We're really, really in trouble, that's for sure. So we were talking about contracts and how people start playing with drugs they start with a cigarette, then they smoke a little weed, and then they go to parties, and they're getting desensitized, they're getting a little bit high, they're drinking a little bit of booze, and they start playing with other drugs. And those other drugs, it's simply they're a 1-2 time deal, and you can get emotionally addicted to those drugs. And then we look at the crisis we're in right now with the other hardcore drugs that are out there, and the amount of people that are losing their lives in our country, 5 an hour minimum. That's just accidental addicts again. That has nothing to do with all the other reasons people die from drug abuse or people go to prison for drug abuse. I can go on for days. We can do 2 shows on that or more.
And we've had people sitting right here next to us on the show talking about how it ruined their lives.
Oh, yeah. There's a funeral this week for a kid, Alex Ziegler, and his father died a few years ago from the same overdose. So they're getting buried right next to each other, and they both died from opiate overdose. And I guarantee you, when they were young, their plan was not to die from a drug overdose. Their plan was not to get addicted to drugs. Their plan was never to use drugs. And they're both dead. And the family, brothers, sisters, and mom, they all got to deal with this now. So we need to pay attention to it. And this is, again, for the parents that are listening, all drug abuse starts innocently. All drug abuse starts innocently. Somebody smokes a cigarette. They drink a little bit of booze. They smoke a little bit of weed. And before you know it, oops.
Too late.
So if your children start smoking cigarettes and drinking alcohol and smoking marijuana, you better pay attention to it.
Yep.
Our job, our deal in life right now is to beat that number up. We don't want people dying. We don't want your kids to die, but we can't do the work. You have to. And it's not the school's problem. Well, it's all of our problems, but the reality is it starts in our homes. We are in charge of our homes, nobody else. So we have to take control of what's going on, and we have to be responsible for our children.
We do.
Yeah, so don't get into that it's only pot stuff. Because I've seen way too many people, it's only pot stuff. I've been to their funerals. So,
that's it. And you have the voicemail messages to prove that.
I got the voicemail messages. I got the emails. I got it all here on this phone.
Parents who called you to say, I just wanted to let you know that
my kid's dead.
Yeah.
Yeah, I got them. Many, many of them. So, and that's not even including what it costs this country.
Oh, boy.
And you probably have some info on that.
I do. Here's an action item. Cary, every week I read these and I start off by saying, here's an amazing number. Here's a stunning number. And after a while, you just get numb to that, right? I'm not going to say that today, but I know.
Somebody did ask me the other day, how is it that you can do this so long and see so much tragedy in your life? And not burn out. First of all, I don't think I could do anything else. Mm-hmm. This is what I do, and I love what I do. And yes, I see a lot of tragedy, but I see so many successes. Mm-hmm. There's a little girl sent me a thing today. Baby was taken from her at birth because she was addicted. And they're doing reunification now. The courts are letting her get back to see her child. Mm. And she's doing really good. So I see so many successes that it's worth it.
If I were to ask you or our listener out there how much Americans spend every year on drinking, smoking, and taking drugs. Now, this isn't what it costs society. This is how much how many times we reach into our wallet or our purse and pay for alcohol, tobacco, or taking drugs. Hold on to your seatbelt.
In the billions for sure.
You are right, Cary.
Of course.
$276 billion with a B a year. That's how many dollars we are forking out to smoke, drink, and take drugs.
Let me get this straight. $200 and something billion to
76.
use something that can harm us.
That's right. That's right.
You know, it really blows my mind. When we were kids, I'm just going to pick a drug for a minute, right? And when you bought a pack of cigarettes, it used to say, the Surgeon General warning, cigarettes smoking might be dangerous to your health. Now it says things like, the Surgeon General has determined that smoking causes lung cancer. I mean, those kind of things. And this is for people that are smoking. My mother passed away about 5 years ago, and she had stage 4 cancer. And I was with her at the doctor that does the cancer doctor, and she looked at him and she says, how did this happen? How did I get this? And I'll never forget his look in his eyes when he said, Esther, it says it on the box.
Well, Cary, as you know, my mother had passed away a year before your mother did, and she died of COPD, not cancer. But she had the same conversation. She asked the doctor, how did this happen? He said, Louise, it's been happening over all these years that you've been smoking.
Exactly.
And my mother,
folks, it says it on the box.
My mother thought about that, and she got so angry at herself. But then it was too late. You know, you can jump up and down and scream and yell all you want. By that time, you're toast.
We have
nothing you can do to reverse it.
We have one body.
That's right.
And if we don't treat our bodies the way they're supposed to be treated, and they start breaking, who pays the price?
We do. Listen to this. Americans, I'm going to repeat it. Americans spend an estimated $276 billion with a B dollars every year on drinking, smoking, and taking drugs. Now, let's put that in a bit of perspective. That's more than the federal government spent in 2015 on education and veterans benefits combined.
Wow, that's
about half of the spending.
Put in that perspective, it's pretty disgusting.
Yeah, about half of that spending, about half of the $276 billion that we spend, goes toward alcohol and nicotine. All right, non-medical prescription drugs, including painkillers, tranquilizers, and stimulants, make up almost 22% of the total, and marijuana, cocaine, heroin, and meth account for another 28% of the total.
Wow.
So we're just, shoveling in the
illegal drugs.
We're just spending in a whole lot of money on killing ourselves and screwing up our lives, right? That's exactly what we're doing. Hey, listen to this one. Another action file item.
More bad news?
Well, it ain't good.
Okay.
Prescription opioid addiction risk among young adults jumped 37%. A new study finds that the risk of prescription opioid addiction rose 37% among young adults between 2002 and 2014. Again, these numbers are a little old, so it's going to be more than that now. Past year heroin use also rose among 18 to 25-year-olds from 2% to 7%. Among adults aged 26 to 34, risk of an opioid use disorder more than doubled from 11% to 24%, and heroin use among this age group rose six-fold to 12%. So it just keeps going up, 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 up. And you know what happens when it gets top-heavy? The whole thing collapses.
Well, I think we're seeing that now, aren't we? With the amount of people that are dying in our opiate epidemic and all that kinds of stuff, we're seeing that. We've been screaming that here on this radio show for the past 5 years.
At least 5 an hour will die. During our show, 5 people will die, but we know because those numbers only go up to 2014 that it could well be, in your estimation, double.
Yeah, I would.
Could be 10.
I would believe that it's closer to 10 than it is to 5.
That's insane.
Because it used to be 3, and then they went up to 5 when the newest thing. So the numbers keep rising.
Now, one of the things you've talked about before, Cary, and this is interesting because you already said a lot of kids are looking to their moms and dads. They're smoking. Maybe they're doing other drugs. One of the first places that teens find their drugs is in mom and dad's medicine cabinet, where they keep whatever the doctor's given them for painkillers, antidepressants, whatever they bought over the counter.
And also the marijuana. You know how many children, I'm talking 12, 13, that we say, where'd you get this pot? Well, I took it from my dad's drawer.
Yeah.
So ask yourselves, I'm not even going to get into it. Just makes me pretty sad.
Well, what I was getting to, Cary, is the SCV Drug Take Back that the Action Foundation is sponsoring along with KHTS and Henry Mayo and the Sheriff's Department. And, we're saying to people, if you have expired drugs in your medicine cabinet or something you've thrown into your garage or you've left in your glove compartment or the trunk of your car or what have you, don't flush them down the toilet. That's very bad for the environment and for the little fishies swimming around in there. But what can you do? Okay, no questions asked. It's no problem. You drive up to the front of Henry Mayo on Saturday, October 22nd, 10 a.m. to 2 p.m., and you can dispose of your drugs. No one's going to ask you thing one. You don't have to explain yourself. You just say, here, it's what I'm dropping off. We'll take it from you. Cary and I'll be there. And the sheriff and the DEA actually incinerate the material that we collect.
Yeah, it goes away.
Goes away, bye-bye.
It's history, and no matter what you bring, it doesn't matter. You can bring us aspirin, and you can bring us cocaine. It's going to be gone, and nobody's going to ask you any questions.
It's a very cool program. We do. I have.
Why is it so important to get these drugs out of our cabinets, Mike?
Well, you talked about it already.
Let's refresh people's memories.
Well, for one thing, we're saying that your children may very well find them. And, well, here in Santa Clarita, we know for a fact that they have medicine cabinet parties. Teens get together at a house where their parents aren't there. There's no supervision. And they're getting into the medicine cabinet and saying, hey, look what we found.
But my kids know better. They'll never do that. What about your kids' friends? What about your friends? We're having a little situation even with real estate now, that people are going to open houses not because they want to buy homes, but they want to use your restroom and go through your medicine cabinets to see if they can find any Vicodin or any of those kind of pills.
Yeah, and real estate people are now having to actually take courses in how they can protect from those sort of things.
Exactly.
People are being told, hey, bag up everything that's in your medicine cabinet and take it with you when we do your open house, because people will show up and look through the house and say, excuse me, I need to visit the restroom, and while they're in there, they help themselves. Now, Cary, you wrote an article.
Buy a safe. If you're going to keep these drugs, even if you're smoking pot and you have children, buy a safe.
Keep it away from them.
Keep it away from your children.
Because they'll find it. It's just laying around somewhere. You'll forget it. We've talked about this before, that there are toddlers who have, one died, and we know that a bunch have ended up in ERs with toxicity from nicotine, from vaping, and the parents accidentally left a little vaping e-juice container on the coffee table somewhere where the toddler could get to it, and they wind up sick, and in some cases they've gone into comas, and in one case we know they've died. So kids do get into this stuff.
It smells delicious.
Yeah.
And why wouldn't a little 2-year-old smell that?
It smells like candy, smells like cotton candy, smells like all kinds of things. They make it to appeal to teens.
They do.
You wrote this, Cary. The drug take back is one of the most important things we can do for our children. When I'm working with children and asking kids where they're getting their drugs, they say, from mom and dad's medicine cabinet, from their dad's desk drawer. They got all these prescriptions, things that are expired. Hey, listen to this. In September 2015, more than 3,800 federal, state, and local counterparts took in more than 702,000 pounds of unused, expired, or unwanted drugs at more than 5,000 location sites across the United States as part of the National Prescription Drug Take Back Day. But dig this, Cary. Since the DEA launched this initiative to do the drug take back in 2010, the Take Back Day events have collected over 5 million pounds of drugs.
Pretty good stuff.
Yeah. Well, America is like the drug capital of the world.
And these are drugs that are killing people. And we're getting them out of harm's way.
And so you, along with KHTS and Henry Mayo Newhall Hospital and the sheriff, have put together the local version of that, which is the SCV Drug Take Back. And write this down. Saturday, October 22nd, from 10 a.m. to 2 p.m., right in front of the hospital. You can't miss it. Just drive up. You'll see Cary's smiling face there, me. You just drive up and you just give us our drugs. It's going to take you all of about, 2 minutes?
That's just, not even.
Not even.
You drive You don't even have to get out of your car. You can hand it to us, and we put it in a box. We don't even look at it. We don't care.
No, we don't care what it is.
It gets sealed. The DEA takes it. It gets incinerated. It's
what
gone.
a deal.
Yeah.
I'm going to repeat it. Saturday, October 22nd. So you've got time to make your plans, 10 a.m. to 2 p.m. This will take a smidgen out of your day.
We had just two stories. We had somebody last year come and I could just see the fear in their eyes, and she, I'm sorry, said, I got some drugs in here that's not real kosher.
Oh.
That's what she said. I said, no one's going to look and nobody cares. And you could see the relief, and we threw it away. And then I had some poor guy come in. I think you were standing right there, and he had bags full of cancer drugs.
That was the year before last year. I remember that. His wife had passed away.
And pain meds, plenty of painkillers. And he said, I've been waiting for this.
He had this in his garage.
Yeah, so
he cleaned it out in the trunk of his car.
Yeah, so anything that you have, it's a clean way of getting rid of stuff. It's a safe way of taking care of our planet and making sure our children are safe.
It is. This is a good thing. Saturday, October 22nd, 10 a.m. to 2 p.m., the SCV Drug Take Back. Just come out there to the front of the hospital, give us a quick visit, and you'll be on your way. And you'll do a great favor to the community.
Yeah,
great favor. This is another wonderful thing that Action Family Foundation does, and KHTS, and the hospital, Henry Mayo, and the sheriff.
Absolutely. Well, we want to keep our community safe,
and we don't want your kids to be looking through the house to see what you got stashed somewhere. Open that medicine cabinet or that drawer in your office and find, oh, look at this.
Parents, you got to hear this. Almost every adolescent that we deal with, when we say, where did you get those pills? Somebody's medicine cabinet.
Yeah,
they did not go to a doctor and get a script. Somebody else did. These kids found them.
Same thing with alcohol. Where did you get the booze? Mom and Dad's cabinet.
Yeah, we were dealing with a child a few months ago that had alcohol poisoning, almost died. And it was the parents' tequila. And boy, did they feel bad.
Oh, boy.
Yeah.
But they'll find it.
No, the alcohol's out of that house, and the kids won't be able to find it anymore, not in that home.
I remember not too many years ago being over at this person's house for the first time, and they actually had a young child. Well, I say young. I want to say 10 or 11 maybe. And, I guess that's young. Yeah. So anyway, over in their living room was a very prominent bar with all kinds of bottles of booze. Very colorful. So one day that child's going to say, I see my dad and his friends drinking this. I wonder what it tastes like.
Right.
And they're in trouble.
So many kids, when you first drink, 9, 10. How? My parents were drinking. There was a party. I picked up a cup.
I've told you my story.
Yeah. But that's how it starts.
I was 6 years old, and that was horrible. I'll never forget that as long as I live.
What happened?
My parents had some beer, and it was sitting on the coffee table. They were out saying goodbye to their friends, and I happened to notice it. And I thought, well, they were drinking. It must taste good. So I went to take a sip. Well, somebody had put a cigarette out in it, and it gagged me. I was rolling around on the couch. My mom walked in and said, "What's wrong?" And I said, "It tastes terrible." "What are you talking about?" I said, "I drank some beer." Of course, my mother got very concerned, and after that, they told all of their friends, "Do not, under any circumstances, let him take a sip."
Well, a lot of parents think it's really cute.
I was on the wagon at 6, Cary.
Yeah. But a lot of parents think it's really cute to get their kids buzzed.
Ooh.
They really do. I mean, if they're drinking a little bit and they're a little buzzed and there's a little 3-year-old, let's give them something, and it's not cute.
No, it's not.
I was at a dinner thing a few months ago, and there was a young kid, probably 4 or 5, 6 or 7, and the parents were drinking a lot of wine, and they gave this kid some wine, and I actually watched over a course of period where the parents got a little more tipsy, and they gave the kid just a little more, and the kid was tipsy.
That must have been hard for you to watch.
Yeah, I almost said something, but you know what? I wasn't going to go there. But it sure weighed heavy on me because you don't do that to a child.
So if you've got it laying around, they're very likely eventually going to go to that and say, "I wonder what that tastes like."
Well, they gave the kid the wine. And the kid was actually, he kept picking it up and taking sips, and they were okay with it. And you could actually see this child get a little bit intoxicated.
Which wouldn't take much for
he was actually buzzed. So you get a 6-year-old that is drinking and feeling pretty good, it's a pretty dangerous situation, and parents think that's cute. I didn't think it was much cute.
No,
I did not think it was very cute at all.
Cary.
Yeah. So, anyways, if you're
Is
going
it
to be
time
a
for a
parent,
break?
be responsible. If you're
wanna
going to
take us into a
drink,
break?
be responsible. Right? If you're going to smoke your pot, be responsible, and protect your children. Let's go on break. This is Families in Action on your local hometown station, AM 1220 KHTS.
By the time people hear this delayed broadcast and see us on YouTube, it will be history. You will actually be that age, whatever it might be. Cary, one thing before we leave today, we haven't mentioned this in a while, but we need to talk about the ignition interlock devices.
Why don't you let our friend talk about it?
You know what?
Silent partner. Come on, grab that mic, Justin. Let's hear about it. You know, it's important to you, too.
It's very important to me because I actually had a situation where I got a little too drunk this past Friday night.
Right.
And in Los Angeles, and I took a very expensive Uber ride home. But
that's great that you did.
But when I woke up Saturday morning, I didn't feel that bad because I know that I might not have made a great decision Friday night drinking too much, but I was responsible in the fact that why would I ever get
behind
the wheel, especially after I heard on our CNN news earlier in this morning that someone drunkenly killed a few high school students.
Yeah, it's terrible.
And I mean that it happens every day, and it's something that we can change. We can change it quite easily. So why don't we?
It makes no sense to me why every car coming out of the factory don't have that breathalyzer or whatever it's called.
The ignition interlock device.
That when we get in our car, we go, whoo, and if we're too drunk, the car won't start. It doesn't make any sense. Does it?
No, it doesn't. And, we are making progress because California is going to require that statewide for anyone that was convicted of drunk driving. They're going to have to do that. But we'd like to see every vehicle.
We want it so much further than that. We want to go so much further.
Yeah,
we
not
want
just
every car to come stock with an interlock ignition device because it would so easily save lives. And that's all that matters to me.
Do you know that almost all drunk driving accidents would be stopped? Almost all drunk driving deaths, fatalities would stop because you wouldn't be able to drive a car.
You cannot drive your car.
It makes no sense why it's not done, and the expense is minimal.
Think of the lives saved.
Yeah, and I think only a couple, we've been talking about this for going on about a year, and only a couple people have, why would I have to do that? Because it might save your kid that somebody else is now doing that.
Which is funny. Think about it. They don't mind reaching into their pocket or their purse and searching for their keys, getting their keys, having to use their key to start the car because why? They've been doing that since day one. But you introduce a little thing, and this would take, 2-3 seconds?
A few more seconds.
You just puff into this thing.
And
if you're not over the limit, you'll be able to start your car.
Exactly. That doesn't mean you can't drink.
Right.
You can go to a restaurant or a bar and have a drink,
have a glass of wine. Right?
But if you're drunk, if you're over the legal amount, your car won't start.
Ignition interlock devices, they would save lives. They do save lives. Otherwise, the state of California wouldn't be requiring it for people who have been convicted of drunk driving. So because they did a test program before that, and they found out that it worked. And then so the governor and the state came together and said, let's do this statewide. Now I agree with all of you, Justin and Cary, which it should be across the country. Not just for people that have been convicted. Let's not wait that long. Let's just do it for every car. That way we do away with the problem.
And you can do the statistics. It's pretty simple to find the numbers. Yes, there's a lot of repeat offenders that go out there, get drunk, and kill people. But there's a whole lot of people that aren't even drunks. They just drank too much, and oops, they get behind the wheel of a car thinking they can drive it, and they can't, and somebody loses their life, or these people get arrested. The arrest would be gone. The lives would be saved, and it makes no sense why it's not happening already.
And where are your priorities or your sense of humanity? If we can save lives, if we can do something so simple that we're required to have car insurance, we're required to have so many things responsibilities to drive cars. We've gotten to a point in our society where we are irresponsibly driving all the time, and it's something. If we can change it, then why wouldn't we?
The amount of lives that are lost due to drunk driving is pretty sickening.
And property damage and everything else. I mean, you just add it up. And the time that it
attorney
takes.
fees and court
How much money you spend if you get a DUI.
Oh.
Why would you want to put yourself through that?
Law enforcement has to go to the crash. First responders have to go because people are injured or killed. It's a mess. It backs up the roads, the freeways. I mean, you name it. It just is mushroom in terms of the problem. So we could do away with it. Interlock ignition device.
On that note, Mike, it's getting to be close to our time, isn't it?
It is, I think so.
What do you think, Justin? Do we need to close?
We got to go, guys.
This is Families in Action on our hometown station, AM 1220 KHTS. Have a safe week to next week.
Happy birthday.
Thank you, sir.
Happy birthday, Cary.
Thank